You know, if your dad made the inserts for the,
He probably did.
because they used to just do it in mason jar and stick them in there, but now there's a ring and there's a mesh grid. That's kind of sick.
But I bet he did.
Yeah, they look like, because they're not fastened into the.
Yeah.
Looks like
Good idea.
Van Nelson is on. See Judge Sharp is there. It looks like the rest are
If you want them back.
staff.
Because then they can have that.
Dropping off extra
All the little
bouquet
flippers.
that I-
All right, I'd like to call this meeting of Health and Human Services Board to order on Thursday, July 8th at 31. To make note that we do have everybody present and Supervisor Nelson is on Zoom, and virtual. So with that, I would entertain a motion to, was this meeting properly posted?
Yes, it was.
Wonderful. I would entertain a motion then to approve our 16-point agenda.
I move that we approve the 6th agenda that's as presented.
Motion by Cindy Chicker, second. Seconded by Diane Cox. All those in favor signify by saying aye. Those opposed say nay. Motion carries. So we're gonna go right into our public hearing. First off, I'd like to do introductions. So I'm Supervisor Severson, County Board Member and Chair of Health and Human Services.
Tim Gatchell, County Board Member.
Rick Harris, County Board Member.
Diane Cox, community member.
Ingrid Glassman, registered nursing county board member.
Cindy Chicker, community member.
Megan Rowe, confidential.
And Tracy Thorson, Health Services Director.
Those are all present here in our room. Van, introduce yourself on the internet.
Van Nelson, County Board Member.
Wonderful. So what, going into public hearing, we have a few kind of ground here. Everyone present is welcome to address the board members of Richland County Health and Human Services. The purpose of the meeting is to solicit comments by the public regarding the services to assist in the development of the 2020 budget and plan. We ask that each individual wishing to speak sit in a designated chair at the table when called upon by the chairman. We have a designated spot. All right, so our designated spot would be Chicker and Megan Roan. And you should identify yourself and the organization that you represent, if any. The chairperson reserves the right to limit comments to a time period if needed, as determined by the number of those present wishing to speak. And the public hearing will conclude when the last member of the public wishing to speak has an opportunity to do so. With that, I guess I'll the floor up here for comments. Anybody wishing to speak on our future budget for 2022 and plan? Sorry about that. Is there any public comments? Anybody wishing to speak here? All right, is there anybody virtually wishing to speak?
I'm sorry, this is District Attorney Jennifer Harper. You're cutting in and out. Are you asking for public comment on the budget?
Yes.
Ms. Olson?
Hello, I'm Tiffany Olson, the Richland County Treatment Court Coordinator. We have a few officials here from the Richland County Sobriety Court. And we would like to just get some information out there that we are hopeful to be applying again in 2022 for funds to support not only a sobriety court program, which we currently have, but we are also seeking funds for a drug treatment court. This is the 5th year of our 5-year cycle that we have been operating our sobriety court under a treatment alternative and diversion grant through the state of Wisconsin Department of Justice. And for 2022, the funding cycle is opening up again to allow for changes. It's also competitive. We have had this grant again for the past 5 years, but this is a new 5-year cycle. And we just wanted to, sorry, I hear an echo as well. I'm hoping you can hear me. Are you hearing me okay? Or?
We can hear you okay.
Okay, sorry, I was getting messages that there's an echo. But we just wanted to share some information in regards to what we'll be seeking for next year. Again, we have to reapply to seek funds to run our current treatment court program, which is solely an alcohol-based program. And we are hopeful to be seeking funds as well to add a drug court program to Richland County. Richland County is one of the few counties left in the state that does not offer a specific drug court program. So we are looking to get on board and meet that need in our county as well. We have District Attorney Jennifer Harper and Judge Sharp here virtually to also speak to that need and their wishes to add a drug court program to Richland County.
Your Honor.
Thank you, Tiffany. Judge Sharp, would you be willing to speak?
I think Judge Sharp is attempting to speak, but I don't think anybody can hear you, Judge Sharp.
You trying to talk?
Yeah.
So Ms. Harper is kind of miming to me that I cannot be heard.
We got you now, but before we did not. Thank you, Your Honor.
Well, I certainly don't know what changed, but every day it is a new experience with this new sound system, but I don't want to get off on a tangent. We have finally started seeing the increase that has been threatened for so many years. I was told by one of the drug court officers 20 years ago that we were going to begin to be inundated with meth cases. And it didn't happen, and it didn't happen. And in the past 5 years or so, it has started happening. And now it's gotten to the point where almost, it seems like every time the officers stop someone, a traffic stop, they do a search of their vehicle, and lo and behold, there's meth in the vehicle. This is going to be a substantial problem. I think it already is a substantial problem, but it's only going to get worse. As much as drunk driving is a scourge against the public and public safety and broken hearts and broken homes, meth is the most destructive drug that I have ever seen. There's also a problem, obviously, with opioids, with heroin, problems that I personally know and have experienced, unfortunately. in my own family. And the drug court is the sobriety courts, the treatment courts are the most effective way to deal with these problems. The state is offering grants that are going to substantially pay for the programs, and the county simply has to come up with a match. I think, as was noted way back when we first asked for this back in 2016 or 17, it really comes down to pennies on the dollar as far as the county's portion of it is concerned. And if we don't do something, it's going to be a problem for everyone, a substantial problem. We're not saying that we can cure the problem, but it's the best way found to deal with the issues that are presented. I think that we're all safer with someone looking after these persons with these problems. Treatment court generally meets every 2 weeks. They are under daily scrutiny by the treatment court coordinator, Ms. Olson, and the people that assist her. And it's a real way to try to assist them to turn their life around and keep the public safe at the same time. So I at least am committed to trying to bring a drug court to Richland County. And I am hoping that this committee and the county board will see that it is a worthwhile and useful thing to do, and will be willing to assist us and provide the financial backing that is going to be required. So I think that Ms. Harper is also prepared to address the situation as well. Ms. Harper?
As you can imagine, I've been sort of a rabble rouser to get a drug court. I don't know how often I say to either defense counsel or Judge Sharp, it's too bad we don't have a drug court because this is the exact person who should be in it. Over the course of time, since we've had this the alcohol court, I ran some numbers today. They're preliminary numbers, and sometimes they're difficult to suss out. But essentially, between our cases, it's about 60% alcohol-driven and 40% drug-driven. That means we are capturing just over a half of the cases that would be important to go into some kind of treatment court. Being limited to alcohol, we're really don't have the ability to put our resources towards the people who are really having more and more difficulties. I note your honor. I'm used to saying that all day long to Judge Sharp. I note your honor. In any event, so the 60-40 split was an aggregate over the last 5 years. What I didn't do for today is to suss out and split that out per year. And I think if I did that, we would see maybe the first year was 80% alcohol, 20% drug. And the next year might be 60% alcohol and 40% drug. And now we're up to 80% drug and 20% alcohol. It is, for anyone who spends any time in court, almost all of my cases involve meth in some way. And every little crystal of methamphetamines is its own little pocket and packet of crime. There are a number of other crimes closely associated with meth and other drug use, including burglaries, which, although it's a property crime, can be very traumatic. If you can imagine someone breaking into your house and doing whatever they do, it is a property crime, but it is one that hits very close to home. So we're just absolutely seeing an uptick in that. And we can't really so we call it treatment court now, but we work with basically people who have alcohol problems. And some would say, well, since it's treatment court, let's just stick them together. All the opioids, all the meth, all the heroin, all those folks together with the alcohol. And we've learned from treatment providers and Your Honor, sorry. And the judge has also learned from other courts that have these type of programs that these different groups of users have absolutely different needs, different cognitive distortions, different, all kinds of different needs. So we can't just lump them all together. And we've talked a little bit about meth, but this is how it works in the drug world. Once upon a time, LSD was really hot. And that was about 50 years ago. And in the 80s, we've got cocaine. And then we have crack. And then we have heroin. I had a meeting with my law enforcement about 5 years ago, and we were going to have to go storm an apartment in a specific area of this county. And we were going to hit that really hard to get rid of the heroin. It was February of the next year where all of a sudden we're in a different area of the county because it's all meth. And so once we're getting good enforcement on meth, and we can see that because there's really been an uptick in referrals to my office and charges regarding those. But if we take care of the meth, something else is going to come in. So it's not like we really just need a drug court to take care of methamphetamines. It's when this goes, there's going to be something following it up. And it's really unfortunate that we don't have a drug court. Your Honor hears me say this all the time. This person would be perfect for drug court. Too bad we don't have one. And let's see what we can do to get one. I'd also say with the finances, it is pennies on the dollar, but I think one set of numbers that it's difficult to capture as well. Folks who are in these programs right up front are spending less time in jail, right? That is an aspect of the structure, how we structure sentences for treatment court. So right off the bat, you get the benefit of being in treatment court. One of the benefits is getting less jail. Jail is expensive. Not only the daily cost of food and 3 hots and a cot. If anyone is sick, if anyone has meds, if anyone has any kind of health concern, then the county has to pay for that as well. So the more we can keep people out of jail, not just the treatment aspect, but that also saves us quite a bit of money. And I know that is something that is should not always be the driving factor when we come to policy decisions, but it is a factor. So all in all, I think it's important that we start a drug treatment court. It dovetails with what we're already doing now, but it would also expand the program in such a way that we would capture more offenders and be able to provide more treatment and services to the offenders that we currently that we can't work with through this type of program. So I know moving forward, we're going to have a lot of details about matching and how we get the grant and how we don't get the grant and how we have to work with the county. But I think we wanted to give everyone the heads up that this is something important. By the by, I know Judge Sharp doesn't really like meetings. Quite frankly, I don't like meetings. I don't like meetings after hours. I would rather be doing things with my children or sitting on the couch eating Cheetos. But this is important enough to come to. And see, Your Honor is laughing, so it's funny, but it's true. It's important enough for all of us to come and say that this is a program that's important to Richland County. And I'm hopeful that when the time comes, the county will give us the support for it.
Okay, thank you. Anybody else that's wishing to speak on treatment court?
I would just add that we are working on a proposal to apply and bring that request to the board and ask for additional funding in the budget, either in August or September. Just our early numbers, and Robin may correct me if I'm wrong, but we're thinking likely like between $8,000 and $10,000 additional in-kind costs and approximately $20,000 in additional match costs above and beyond what would be requested in the grant dollars. The grant would be approximately $150,000, but we'll have better numbers for you when we do make the formal request.
Thank you, Miranda. Thank you, Tiffany. Hey, Judge, appreciate your comments. Are there any other comments for the public hearing on our 2020 budget? One more time, are there any other comments? Board members, employees? Wonderful. I will close this public hearing now at 17:50. Thank you, everybody who participated and provided your comments.
Thank you.
Welcome. So we're going to move on to our next agenda item, which is number 3. Any citizen comments? Any citizens that wish to address the board? Okay. Then we have our minutes from our June 10th, 2021 Human Services Board meeting. Is there a motion to approve our minutes? Any additions or corrections? Last runner to approve from June 10th. Is there a second? And by Cindy Chicker. Any other discussion? Hearing none. All those in favor signify by saying aye. Aye. Those opposed say nay. Carries. To number 6, our director's report.
Thank you, Mr. Chair. Holding the public hearing tonight kicks off the 2022 budget planning process for Health and Human Services. This week, the Finance and Personnel Committee approved the guidance for developing the county department budgets. This guidance includes a directive to build our budgets, anticipating a 7% health insurance cost increase, and bringing the county pay plan up to date, which will result in an overdue wage increase for the county employees. In addition, the direction is also to develop our budgets with no increased tax levy. It will definitely be a challenge to incorporate these increased expenses with no increased funding, and also try to meet some of the increased community needs, like implementing the treatment court, the drug court, and trying to expand some of the needed mental health services for the community. So Robin and the management team have already begun the substantial work of building the unit budgets that will be combined into the agency budget. We will present our proposed budget to this board next month, and then continue through the review process with the county administrator and the Finance and Personnel Committee in August and September. So we have that to look forward to. Perhaps one of the most significant things for me to report this month is my continued concern with staff turnover for Health and Human Services. As I shared with the board in the presentation at our May meeting, staff turnover has been quite a challenge this year. With most recent resignations that we'll discuss later in the meeting, we will now have lost 11 staff just in this year alone. And this puts our current turnover rate at 17%. 9 of the 11 staff who either have left or will be leaving have indicated that being offered higher pay was a primary factor in their decision to accept another position. So we know that that is a substantial issue, which we hope will get addressed when we do the budget for next year. We also continue to struggle to recruit experienced staff for our open positions. We currently have 12 vacancies that we're trying to fill. And we are in the interviewing process for some of those. Child and youth services staff have been very busy managing their increased caseloads and workloads due to having 2 vacant positions in the unit. We have been able to fill the family preservation position. That's a part-time position. And while this position cannot do some of the investigative and legal work that the social workers need to do, it is expected that it will help to meet the support and education needs of families involved with services. The behavioral health staff are sharing in covering the adult protective services duties until that vacant position is filled, and they also continue to share in the crisis duties because of vacancies. On a positive note, with the recent hiring of a new clinician through Southwest Workforce Development Board, eligible individuals will have a shorter wait time to enroll in our CCS services. So we're glad of that. In economic support, the food share, Badger Care, and Medicaid programs continue to operate with more relaxed requirements, and many of the timelines are continuing to be extended and waived. Right now into October, it looks like that will continue. The Child Care Task Force continues to meet monthly to try to increase the number of regulated providers in Richland County and the surrounding area. And finally, our ADRC will host a public hearing of its own on July 14th for the 2022 5310 Operating Assistance Grant, which funds our transportation programs bus program. The grant will help the program leverage up to an additional $29,000 in funding for 2022. The ADRC is also working on its 3-year aging program, which is a requirement for the county to receive our aging funds. To prepare for the creation of the plan, the ADRC has been gathering surveys and has had listening sessions at local libraries, apartment complexes, with the Commission on Aging Board and Nutrition Advisory Committee, and with various groups in the county. The information gained from these meetings and surveys will be used to create goals for using the aging funding that we receive. And then once the information is gathered, a plan will be put together and then brought back to this board for approval. That would also go to the county board and then finally to the Greater Wisconsin Area Agency on Aging and Resources. Mr. Chair, that's my report.
Thank you, Tracy. Are there any comments or concerns from board members to address with Tracy about her report? Dr. Barris?
Tracy, is there going to be a point with all these resignations that we're not providing services or filling them with agency personnel? Or what's the plan there?
Yeah, it is a concern. You know, right now our staff are managing to meet all of the basic requirements that we need to meet for services, but I couldn't possibly say that we're providing the extent and quality services that we want to be providing. So right now, staff are, you know, putting in extra time and taking on extra duties and trying to cover all of the things that need to get done. But you know, if this continues, there could be a critical point where we really have to take a look at, you know, do we have to cut back on something that we're doing in order to do just the basic services that need to be delivered?
Do we have the ability to use other, like the agency personnel when you need them, or is that something that they can't even provide?
I'm not sure.
Southwest or I forget.
Well, we certainly, you know, we recently hired a clinician that I mentioned in my report through Southwest Workforce Development Board, because we weren't able to recruit one of those vacant county positions. And it's because we're able to be a little more flexible with how we structure those positions. County positions tend to be very, if it's a full-time position, then the person has to work 40 hours a week. And we were able to tailor this position to what the individual wanted to work 28 hours a week. And so that was helpful to us to bring them on board in that way. So we are able to do some things a little bit more flexibly with those positions. But when they become more long-term, then staff start to feel like there's a big discrepancy between the two, and then they want county positions. Is that what you were wondering?
Yeah, I'm just wondering also, does Southwest have that personnel to give us what we need if that comes to that point.
Well, they do the hiring, but generally when we tell them what type of position we need, they go out and advertise for it. So they don't have staff at hand to draw upon. So they're essentially doing what we're doing when we're advertising for our open county positions, putting an ad in the paper or in the various, the various sites on the internet and trying to recruit, just like we are for the county positions. So there's not a specific staffing agency.
They don't have a pool.
No.
Any other comments for Director Thorson? Okay, let's move on to agenda item number 7, our health officer update. Rose?
Yes. Hello and good evening. Yes, I'd like to report that public health does continue to engage in contact tracing for COVID-19. We also have committed our resources to continue to administer COVID-19 vaccine as well. Those are the two major activities that we are engaged in. However, we continue to work with individuals who call or agencies or employers who call. So we are actively engaged in COVID on an ongoing basis. The numbers of those impacted by COVID have decreased here in Richland County. That means that public health is in the process of resuming as many of its other activities as it possibly can. So we've been doing that, ramping up for a while already, but now we're trying to begin advertising for, for example, childhood immunization clinics. We have been taking in folks who've been wanting TB skin tests, and we've had our loan closet open throughout the pandemic, but we're trying to reestablish some of our other public health activities on a more full-time basis as well. With regard to our nutrition program, all of the dining centers have reopened. However, depending on the size of the center, there may be capacity limits or there may be some other safety precautions that we're engaged in. It depends on the physical environment of the dining center as to whether or not a particular type of limit or a certain type of safety precaution needs to be put in order. So we're trying to reestablish our services as much as we possibly can. I know, Tracy, that you do have statistics. I don't know if you want to share your screen like you normally do, or if you'd like to just direct the everyone who's attending to those particular forms.
Yes, so I have just the data that we pulled from the state's website, so you can see that. But that's in your iPad folders with all of your other information as well. As you can see, I think the June we were down to 10 cases, and so far in July we have had 2 new cases, so we are seeing that go down, fortunately. The number of positive tests kind of varies with the week to week, depending. Sometimes if there's large gatherings, then we see a little bump up in that, but please take a look at the information here kind of as you want. And if you have any questions, either Rose or I could probably try to address them.
Are there any comments?
I do. I have a question for Rose.
Go ahead, Ms. Cox.
So Rose, I look at a couple times a week at the website with the COVID cases. Is that updated pretty much every day, or is that not updated as much as it was?
Some of the graphics that we provide are not updated as frequently as they were. And when I say that we have 3 active cases, that doesn't necessarily mean that they're confirmed cases. That means it could be probable or suspect, but we treat them as if they are confirmed. So they are active cases for us. We've got testing to verify that the person has had a positive test. For example, if a person has a molecular or a PCR test, then definitely that's considered confirmed. But if an antigen test or if an antibody test is run that appears to be positive, then they are probable or suspect. So, but we do have to treat them because they tested positive through another type of testing mechanism as if they are positive. But overall, no, our graphics aren't updated as frequently as they were, at least here locally. However, DHS does routinely update statewide and countywide data on a consistent basis.
Okay, thank you.
If I'm not mistaken, there is on the county's COVID website, not the Facebook page, that does feed directly and. Oh, yeah, okay, so it updates once a week.
So I have a question too. So these positive cases that we're getting, are they through our COVID testing sites that we're offering as a county, or are they coming from hospital admissions? I'm sure the hospital tests for COVID before prior to admission.
Right. We see them through a variety of sources. Some folks have become symptomatic and they seek testing on their own. Other folks we may see who are having pre-admission or pre-operative testing. So we see it through a variety of sources. Our community testing site is not currently operating just because there did not appear to be much demand for the services. However, we do have local testing options available. There is a local pharmacy which performs both PCR and antigen testing locally. But primarily, I'm trying to think of the positive tests we've seen lately. I think those have primarily been as a result of someone seeking testing because they're becoming symptomatic, or they may have been tested in a preoperative fashion. We do see folks who have tested positive who reside in a setting where testing occurs on a frequent or consistent basis. And we've seen some folks who have tested positive just because of scheduled testing that occurs as part of that person's facility's protocol.
Other questions? Thank you, Rose. Move on to our next agenda item, number 8, which is a review and approve Health and Human Services vouchers. Ms. Robin?
Okie dokie. Get Tracy to bring it up. We had a total of $20,552.02 in vouchers this month. The first 1, 2, 3 pages are the transportation reimbursements of mileage expenses and whatnot. So moving to page 4. The first one I want to mention is line number 1. There was a repair for our ADRC bus windshield. Midway through the page, actually the rest of the page almost, is our credit card bill. The only one that's really notable this month is line 10, which is midway through the page for $261.58. With the roofing project, we had some ceiling tiles that needed to be replaced, so we replaced those. It sounds like some of these expenses that we had to pay for related to the roofing project are being reimbursed by the vendor. So, but everything else is pretty routine expenses in our credit card bill this month. Moving to page 5, number 3 down, for Corcoran Healthcare for $330. Those were for more TB skin tests. Moving to page 6, pretty much a majority of the page for line 45, the total was $1,506.67. That's our quill bill, our office supplies bill. We had quite a few chairs that needed to be replaced in our building, office chairs for staff that had either tears in them or they were broken, and staff have been limping along, and we decided it's time to replace some of those chairs for staff. So that's what that is. Moving to the next page, page 7. The very first one, line 27, for $95, I was paying for a booth at the county fair to advertise some of the WEEP services. And then line 53 at the bottom is a good chunk of the lines on this page for $1,034.95. This was a multitude of things this month, as well as the shopping news kind of mirrors the same expenses. We had quite a few positions posted: social worker, worth 3 educator. The public hearing was posted. The secretary position, fiscal specialist, economic support specialist. There was also an ADRC ad for calling for volunteers for our nutrition and transportation program. Moving to page 8, our shopping news total, line 41, almost to the bottom, for $1,232.70 is also high. And in mirror, I'm not going to repeat all the expenses of the observer, but they're basically the exact same ones. And then on page 9, second one down, 32, for Wertz Plumbing and Heating, we had an air conditioner that needed repair. So on the next page, page 10, the previously paid vouchers, the only one I wanted to note was the very first one, and that was rental of the community center. We need to have access to the kitchen, and it's for a large ADRC event of 100 people for the Alive and Kickin' program that the ADRC is offering. Else the rest of the expenses there are routine. And that's all I had to report on. Does anyone have any questions?
Did we receive a bill for the Richland County Fairs spot, or is that just something you just paid for?
Stephanie, are you on the call? Otherwise I can look at the
Yeah, I'm on the call. Is it a bill that we got? I just pay for it. When I send in the registration to reserve the booth, I just pay for it then.
Got it.
Because we weren't talking, because I'm the chair of that committee, we were talking about waiving fees for county entities showing you a county fair. So
Yeah, she had mentioned that, Carla had mentioned that to me, but she wasn't sure. So I just went ahead and paid it to hold the spot. You can always refund me later.
Yeah.
We'll check into that.
Any other questions on our vouchers? All right, motion would be appropriate to approve our vouchers.
So moved.
Motion by Supervisor Gottschall, is there a second?
I'll second.
Seconded by Diane Cox. Is there any further discussion on our vouchers? Hearing none, all those in favor signify by saying aye.
Aye.
Those opposed say nay. Motion carries. I believe that there should be a sheet here today where we can sign off on that.
Yep, Megan brought it over, so there won't be an email this time. She'll pass it around and get your signatures.
What about, what should we do?
And I can get yours by email though.
On to agenda item number 9, our 2021 budget summary and placement report.
Okay, Tracy's got it up on the screen for you there. Through this month should be about 50% utilized. And I'm just going to highlight the ones where there's major, or not major, but a significant difference from that 50%. The building and operations cost is showing 23.3%. You guys following where I'm at? Tracy, you want to have your pointer there so they can see where I'm? Yeah. And that's because we have big expenses to hit usually the month of July. They haven't hit yet. So I'm really expecting this number to change to be more like 50% next month. We have the big workers' comp chart and those sort of charges coming through shortly. Right below that, public health, 62% is over. And that's with us hiring the extra COVID contact tracing staff. But we have those extra expenses, but they're also being reimbursed. So no issue with that. Moving down to CPS contractual services, it shows 27.8%. This is mostly our kinship program. So it's just basically we have less in the kinship program right now. So there's just less money that we get reimbursed for that as well. And then looking at mental health outpatient AOTA outpatient, as well as APS. Those three below all have similar, I guess, reasons why they're low, and it's basically we have unfilled positions. And then the last two, the birth 3 and CLTS, children with disabilities, it's just based on the number of kids. So we're just, again, just not seeing the number of kids that we had budgeted for. Any questions with that?
Any other questions? Budget summary?
If not, I'll move to the middle table. Showing revenues of about 3.3 million, expenses of about 3.3 as well, with a budget balance prior to the chargebacks of Winnebago of 17,236. After we do those chargebacks and we keep all of our allocations, we're showing a positive balance of 92,632. So that's good, a good report. Also, it's really good to report that we're keeping our mental health institute charges much lower than they were last year. So that's positive as well. If no questions, then I'll turn it over to Tracy for the placement report.
All right, hearing no questions. So the placement report, looking at the adult institutional and inpatient placements, you can see that we have had some placements both in crisis stabilization and in the institution. So in adult crisis stabilization, through the end of May, we have had 35,987 in expenses. With adult institutional placements, we have had 74,676. Looking at the adult community residential placements, that has stayed fairly steady, although you'll see that we're down one placement in May, so one person moved out of placement. The total residential expenses charged to the adult placement fund is 225,694. And we started the year in that Fund 54, which is the adult placement fund, with 482,278. A total of adult placement expenses of 336,357. The remaining balance through May is 145,921. And then looking at the child placements, which is Fund 44, with child institutional, inpatient, and detention placements, you'll see that the number of placement days went down. We did move a child out of a placement in May, and we'll see in June that the child returned to the placement. So you'll see fewer days in May. And no detention placement days in May because that individual that was long-term placement there has moved into another level of care. So child institutional placement expenses was $80,001, and year-to-date detention expenses was $22,950. And then taking a look at the child foster care and treatment foster care, you'll see that we did have some increased placements with our treatment foster care group home placements. The total expenses of those group home and treatment foster care placements through May was $163,428, and regular foster care was $11,696. We started the year in Fund 44 with $527,341. through May, we've had a total of $278,074, and that leaves Fund 44, the Children's Fund, with $249,267. So I do want to show you the comparison on a monthly basis. Again, the dark blue lines are the 2021 expenses. So you can see that our placement expenses were probably more comparable in May to previous years. We did have February, March, and April were tended to be less costly in terms of placements. So we're seeing that return to something that is more historical. So if the placement expenses continue as they have through the first 5 months of the year, we would project to end the year at $1,444,000 in placement expenses. And of course, that is over the amount that was set aside in the placements, which is the $1,009,000. Just kind of this report also shows you expense history of placements by type, just to kind of see where the trends are. As Robin stated, our actual institutional costs are trending down for 2021. And that is primarily because the high cost placement that we had there, we were able to move into a community placement that is eligible to receive Medicaid funding. So because it's such a high cost expense, we won't really know how fully our reimbursement will work until we get through that reconciliation process at the end of this year. So in adult community placements, you see that that's up. The institutional placements are down. That's kind of reflective of that one high cost placement. We are using the adult crisis stabilization placement quite a bit more. And again, that is either to divert someone from needing to go into an institutional placement or used as a step down to get people back to the community more quickly. So we want to see that utilized more because that helps us bring people back into the community with the supports that they need so that we can get them out of those higher cost placements and into a level of care where we can serve them. And then here you can see the trending for the child institutional and other child placements. The child institutional is relatively consistent. The detention expenses we expect will go down just because we had that significant placement last year that we are not seeing this year. And then you can see that our group home and treatment foster care is being more utilized in 2021. I believe that's everything I have, Mr. Chair. Are there any questions?
Inpatient placements, how much of them are directed towards the drug-related issues?
I wonder, Miranda, you've shared with me a little bit about that in the past. Are you able to speak to that? Not sure.
She's not here anymore.
Edie, are you able to speak to the kind of what proportion of those institutional placements may be drug related?
I'd say at least 75%. At least, off the top of my head.
Thank you. Edie's our CCS supervisor and is involved with our crisis system as well.
Well, this drug court program that we're looking at, how would that relate to our inpatient?
Well, it could have an impact, although the path to drug court is when somebody is arrested for a drug-related crime. And we may see some individuals who aren't coming into contact with the criminal justice system. But if their use is significant enough, we may also see them in need of that emergency hospitalization. So there's not a real a direct line between the two, but they do influence one another. So individuals who are continuing to utilize drugs may get so impaired and dangerous that they need hospitalization, and that's when these institutional placements may occur. There's kind of two paths to try to get people to treatment in that sense. If they come in contact with the criminal justice system, then potentially drug court becomes one of the interventions that can happen.
Go ahead, Diane.
Question. So there's now some funding through Medicare, I believe, for inpatient institutional care for drug related.
Yeah, Medicaid now will pay for residential treatment for substance use disorders, not institutional though. So if someone requires an emergency detention where they need to be placed at Winnebago, Medicaid, excuse me, that's a Medicaid benefit, will not pay for that. But if we are able to provide them with, get them more stabilized and they can go into residential treatment and they're eligible for Medicaid, that would be a payer source. One of the things that the state has not worked out with that is it will pay for the care provided at a residential setting, but not the room and board costs. That's the same as what CCS pays for. So the county would still, if we were going to help fund somebody, we might pick up the room and board costs, but the actual care and treatment in those facilities could be covered by Medicaid.
So that could be a substantial savings going forward.
Yes, well, in terms of our placement expenses, what you're seeing here probably is not reflective of substance use treatment services. But many of those individuals who end up in the institution, if we had treatment to offer them, perhaps they wouldn't be re-hospitalized or continue to need that level of care.
And I guess that kind of also leads to the question, or something that, a question that came to my mind. You stated that the hope is that to avoid the more expensive placement outside and being able to bring individuals back into the county to receive resources. Do we have enough resources available within the county boundary?
We do not. There are waiting lists for many of the services that people need. There are, there's private counseling available within the community, which is really great, but that is not enough to sustain all of the need. And with our staffing and retention issues, that's preventing us from fully providing the other mental health services for some of those individuals who probably need more intensive kinds of services that some of the private providers may not be able to provide. So we see that there's lots of waiting lists for psychiatric care in particular, and counseling services as well.
So do you track then those individuals who did come back into the community and are placed on these waiting lists? How many have to go back into a treatment center because they haven't been able to receive those resources, thereby costing the county more dollars?
We do see that happening. I don't know if I have statistics to be able to share with you, but one of the reasons why our crisis services are so important is until people can get into regular services, our crisis staff will follow people and continue to try to help them remain, in their recovery or getting their medication or getting their treatment. But if we're not able to do that, then we do see those rehospitalizations that, of course, yes, are more costly and more disruptive for the individuals as well.
Thank you.
Tracy, with institutional costs going down and residential costs going up, that's potentially a good thing, or at least a step towards a good thing. What I can deduce is, are the institutional unique instances going down, or are we we still seeing roughly the same amount of EDs? They're just maybe not resulting in a long-term placement.
If I recall correctly, I think our emergency detentions down this year, and I don't know if Edie, you're able to speak to that at all. That's what I recall when we last discussed that.
I didn't catch the question.
Our emergency detentions, the number of emergency detentions, have they gone down this year?
I believe so.
Could certainly provide some more detailed information for the board on that as well, because we do track those things pretty closely.
Imagine it would be completely anecdotal at this point. Is there any correlation that we can draw to why those numbers are down? It's just our year.
Yeah, I would tend to say, and I'll certainly ask Edie to chime in, but I would tend to say that we're such a small community that, could be just the happenstance of we happen to have more people with those issues, those high need issues happening at a given point in time. It's harder to draw trends. I don't know, Edie, if you have any other thoughts or insights about that.
No, I think it just really depends. It's just really up and down.
Something I noticed here is like 6 years ago, 2015 to last year, we basically doubled our placement costs. 6 years.
I think there's some other factors to that, because I think there was some restructuring of where the placement expenses went. There was a time when placement expenses were more fully in the core budget. And there was a point in time where the expenses, more of those placement expenses were drawing from the placement funds. So like treatment foster care, residential placements had at one time been in the agency's core budget. So one of the factors there is that we also have seen some increase in institutional placements, not this year in particular, but we did have quite a spike last year. So some of that is how the budgets were structured and where expenses were placed, but some of it is showing increased utilization.
Thank you. Are there any other questions? So now we can move down to agenda item number 10, our contract monitoring report. Ms. Reisner?
Can everyone hear me okay?
Yes.
Okay, good. So Tracy, I'll just give you a second to pull that up for me. There it is. So we're looking at the month of invoiced for the month of May. So roughly in the middle there is the column that I looked at whether or not things have been invoiced for May, as well as the percentage utilized on the far right would be 42% then. So on the first page, I'm just looking for items, Cholita. Yep, right there, Tracy. Cholita is over the 42% mark, but if you notice a few columns in, they have invoiced us through June. So actually that is trending okay. A couple down from there is Fond du Lac County. It's at 77% utilization, but we've talked about this one a few times. We did not amend this because there is no plans to continue using them. So likely this will trend right through December as staying at the 77% utilization. So that one should be fine. Two up from the bottom is 65% is Positive Alternatives. That has been invoiced through June, but I think Jess and I had talked about that as well should be trending just fine and not utilizing them much between now and December. Page 2. I didn't find anything there that was concerning. So page 3. about halfway down. Premier Financial Management Services is at 64% utilization. I will have to talk to Lori about that because that is trending quite high. And that is one of them that does every year, that we just kind of watch and see how much the utilization is for the Children's Long-Term Support Program for Lori. That's everything there was okay. Page 4, right at the top, Cornerstone Foundation is at 74% utilization. I do believe Miranda and I will have to get together. More than likely, they've just placed someone more, an additional placement there or something. We've been watching that one for a while. It seems to be one that they've been using quite frequently. So I've pulled that file and I'll be talking to Miranda about that. Page 5. Right at the top is Curio. We talk about this every month. They do bill though a month ahead of time. So they have billed through June. So that one should trend just fine by the end of the year. And page 6, we have one more. Tellurian is at 46% utilization and they've only invoiced us through April. So I was concerned about that one as well. So I've pulled that file and I will be talking to Miranda about that one as well. Any questions for me?
I have one, and I think that's just because I'm still relatively new here.
That's okay.
Wondering, you know, when you say you're going to have to talk to so-and-so about this and so-and-so about that, where does that information then go? To Tracy or to this group in the next meeting, or is it at all possible to take care of all those talking tos prior to the meeting so that you have something to report to this group?
A lot of times it's based on when we get invoices. So especially with this meeting being so early this month, we haven't seen a lot of invoices for June. So they are, a lot of the management team, whether it's children's unit or the birth to behavioral health unit, they're not really seeing the full picture yet of what I'm reporting that's on the county checkbook, if you will. So sure, they can predict if they can before the meeting, but I only see what's actually been paid, which is largely about a month or two behind. So I only know what I've ran from this week as what it's looking like and what is actually been paid. And then they hear this, they get a report today in their mailbox. And then from this meeting, we meet again, and then they re-look at everything. What's going on? Why is this trending higher than it should be? Usually it's corrected within the next month.
I would also say that, so yes, as a result of this report that Angie puts together, then the managers who are responsible for those contracts will take a look and determine that maybe they anticipated that and don't see a need to consider a contract amendment, and they may feel like it's on track because of some of the other information that they know about.
Makes sense.
Go ahead, Diane.
What does the Premier Financial Management Services provide for the children's unit? Or I should say Lori's unit.
I don't think Lori's on the call tonight, but my understanding is they're a fiscal financial, I'm not even quite sure. They pass the money through and pay for services for children and take care of financial. I'm not sure. I really don't know. Is anyone on that has anything to do with this? I can't see everyone here. Let's see.
They're a fiscal agent, and for some of those waiver programs, the fiscal agent is the payer for any of those informal supports that are paid, so that there's a process for how those individuals get paid. They aren't paid directly by the agency or the state. They're paid through that fiscal agent. So if there's timesheets or anything like that that's necessary, they take care of those things.
That is one of those every year, Diane, that just really fluctuates all over the place for Lori. It seems to be one of those every year that I'm always watching, and it's tipping over, and Lori will come back and tell me, well, families are using them more right now. And then maybe by December, it'll trend fine, but usually that's one we amend probably twice a year, just because it's unpredictable.
Thank you.
Any other questions or concerns? Which would be contracts, agreements, and amendments.
Okay, so that one is quite lengthy this month, and it's largely because as I monitor and pull these up through the county's checkbook, if you will, I'm not finding the names are matching up necessarily. So when I've gone back to the management staff of each of these contracts that set them up, it's been discovered a lot of these businesses are doing business as. So in order to be legal, if you will, we have to have the proper name on the contract. And then that helps me in finding actually where the bills are being paid. So that's what a lot of these are on the first page. And it happens to be a lot from the behavioral health unit. Driftless Counseling, you've heard about them for a long time. We've been working with them. That's who we contracted with. Recently, they have been now changed their name to Doing Business as Trailhead Therapy and Mentoring. So I actually now look them up under both names to try and find the bills. The second one is Hope Haven, which I have the contract for 5-door recovery. It's just a little agreement, but again, could not find the bills or paid invoices on the county checkbook, and then found them under Hope Haven. So that is their proper title or name, as well as Hope Haven Rebos United Inc. Doing Business as 5-door recovery. Scroll a little bit. Yep. So there are 2 on here that are, I'm going to skip the Memorial Hospital because that goes with St. Joseph's and just go to the RTP. Again, another one that has had actually, I think, 3 name changes. We've done business with them as Regroup Therapy. Then a couple of years back, they changed their name to RTP Wisconsin SC. And then this year they added the Array Behavioral Care. It sounds like they keep merging or purchasing other companies or something. And now they want to be known as RTP Wisconsin SC, Doing Business as Array Behavioral Care. A lot of their invoices are still coming through as RTP, and we've transitioned finally out of Regroup Therapy. But the other 2 there, Memorial Hospital of Boscobel and St. Joseph's Health Services, is really kind of hard to explain, but they're both birth to 3 providers of OT and PT, occupational therapy, physical therapy. I don't think they do speech, but they may. We are trying to transition out of using the Richland Hospital, and we had come to you a while back with separate contracts with different names, and then their lawyer, or actually it was one merged contract. Then their lawyers looked at the contracts, said they want them split, and the title they gave us was the one listed here, Gunderson Health Systems - Gunderson Boscobel Area Hospital and Clinics, and then the one down below - Gunderson St. Joseph Hospital and Clinics. And now that the lawyers have looked at, so those were prepared and mailed, and now that their lawyers have looked at them again, they would rather have them appropriately labeled Memorial Hospital of Boscobel Inc. and St. Joseph Health Services Inc. This has taken probably 3 months to get to this point where we finally have an acceptable name on each of the contracts that they want to do business with. And luckily, the Richland Hospital has agreed to extend their contract with us from, I think it was supposed to end in March. They've now given us through the end of July, but no longer, because of this trouble with the different named uncertainties and clarifications from lawyers and things when you're dealing with such a large hospital system. So that's what those 2 are. I have these prepped and ready so that tomorrow they can be sent out, and hopefully we can get them signed quickly by their administrators of those hospitals so that those services can start in those areas. So that's the situation with those two.
These name changes, because we have to complete a new contract, the rules, I think it's the rules of the board requires to bring them back through the re-approval process. You've already approved these contracts. There's no change in the amounts, it's just the name change. So it does delay our ability to then fix the contract and get it sent out, but that this is our process at this point in time.
And the last one at the bottom there is one more amendment, and I don't know if Roxanne is on. That's for Simon's Rec Complex, if she wants to talk on that one.
Yep, so we actually were awarded extra funding for our health promotion programs, which is aging funding. And Simon's Recreation, we contract with them to provide those services. So it's just increasing it by the $1,200 to be able to provide more health promotion programs for individuals over 60.
So we would need approval for those amendments. 1, 2, 3, 4, 5, 6 amendments.
Heard our amendments. Is there a motion to approve these amendments?
I move to approve the amendments.
Motion by Cindy Chicker to approve the amendments. Is there a second?
I'll second.
Seconded by Diane Cox. Is there any further discussion on these amendments? We got 6 of them.
Mhm.
Any discussion on these 6 amendments, name changes, and then one, the dollar amount for Simon's? All in favor, signify by saying aye. Aye. Those opposed say nay. Motion carries. Going on to our new contracts.
Yeah, page 2 has 4 new contracts. I believe Edie is prepared to talk on 3 of them, and then I'll let you, I mean, I can go right to Gander's cleaning service first. That would be something for $1,500. We are in need of some backup help, if you will, for our full-time employee here. So roughly a month and a half worth of assistance if needed. And then Edie, if you want to go ahead and explain the other 3.
Sure. Anytime Fitness is for Lori in the Children's Long-Term Support Program. Just hold on one second. They work with the children in the Behavioral Services Unit. They can provide recreational and alternative activities for children with disabilities. It's a request not to exceed $11,000, and that is fully funded. And then the other one, Southern Wisconsin Community Support Action Support Program, or Southwest CAP. It's a request for a peer support specialist, and that is funded by the SOR grant for $9,500. And the final one, Wisconsin Family Ties, requesting $36,000 for a peer support specialist, for another peer support specialist that would work in our behavioral health service unit to work with our children that are waiting for services. And that one would be funded by a CST grant. Any questions on those?
There's no questions. Okay, I guess my one thing is what's up here with Ganders?
I'm sorry, what was that?
Oh, it was for me, Edie. It's okay. Ganders. Do you have more of a specific question? Because I can't really answer much more.
We contracted out with another employee. Help with that.
Yes, so we do have a full-time custodian, and the time off that he will need, our backup employee is not available. But we will need those services for the time period roughly that Angie stated. So it's a more significant period of time that we're going to need that.
So we have an employee that's going to be off for a significant amount of time.
That's correct.
Okay.
Sorry, I can't hear super well. Trying.
All right, so motion would be appropriate to approve our new contracts. Anyone want to make that motion? So moved. Motion by Supervisor Gottschall, is there a second?
Second.
Seconded by Dr. Barris. Any further discussion? Hearing no discussion, all those in favor signify by saying aye. Aye. Opposed, say nay. Motion carried. Moving on to our next agenda item, number 11 or 12, personnel updates.
Yes, Mr. Chair, we have some new hires to announce. Connie Ostrowski, not sure if I said that correctly, and Crystal Adams are our two new economic support specialists who will start on the 12th of July. And I believe we also have two new leased employees through Southwest Workforce Development Board. Laura Radeska, who you might recall her name because we've rehired her. She's back available to work, and so we were able to get her to come back and work in the same position that she held previously. And Cecilia Dagenhart is a family preservation worker for the Children's Unit who will be working 28 hours a week. I'll just keep moving along with personnel updates. Darla Bennett, one of our drivers, has completed her probationary period because they work such limited hours. They have to earn up to 110 hours before they can complete their probation.
So how long has she actually been hired? Like, what's her date of hire?
That's a good question. I don't know. Roxanne, are you able to answer that?
Yeah, I believe it is, it'll be 2 years in September, I believe.
Oh, yeah, okay.
So it does take quite a while. And then sadly, I've got 3 resignations to share with the board. Shauna Kruger, economic support specialist, submitted her resignation as of July 5th. Katie Pachkowski, our adult protective services worker, submitted her resignation and will be done on the 13th of July. And Robin Hampton, our business and financial services manager, is also leaving as of the end of this month. Anytime we lose staff, it's a big loss to our services and to the work that we do. It's a big deal, both to lose Shauna, Katie, and Robin. Certainly that business and financial manager position is pretty key to every single program that we do. And so that's really significant to be losing Robin after she's been here for 2.5 years and really has kind of gotten a good handle on all of the finances involved with each of the programs. So we will, she's training several of us. Stephanie, our economic support manager, is going to pick up some claiming until we're able to fill Robin's position, and she's working with all of the managers to kind of help us figure out how we're going to get by until we can fill her position. Sorry to see all of those individuals go. So we have 12 vacancies currently that we are either currently advertising for or we're in interviewing process. So that includes administrative secretary position that we have interviews coming up. Driver for the ADRC that we do have an interview scheduled. Adult protective services worker, where I think we will be interviewing. We have done some interviews and will be interviewing, as well as that new APS crisis professional that has not been filled since we created it. 2 mental health therapist positions for behavioral health, 1 psychiatric nurse position for behavioral health, the business and financial services manager position, 1 fiscal specialist position, 2 child and youth services case managers. All other positions that we have listed on the memo that's in your iPad folders are on hold because we didn't intend to fill them at this point in time. Are there any questions on any of those?
I have a question. Kind of right at the beginning of the meeting, you said that the county was going to make some type of pay adjustment this year. Is that what you said?
Not this year, and it really won't be finalized until the county approves a budget for next year. So what the county has done is given department's budget direction to plan for the pay plan to be updated. So I think the pay plan was initiated in 2018, I believe, and has not been updated since then. And so some calculations have been done based on the consumer price index by the county administrator. And so if it were updated over the course of those years, then it would be roughly a 7% increase of all of the pay positions from where they're currently. So if that happens, then that would be bringing that pay plan more in line with what the current wages would, I guess, would be competitive.
And the major reason that people are leaving is financial.
That is-
Would that bring us up to anywhere close to what other people, or what these people are getting elsewhere?
Well, there's two factors. I see some people in the back not shaking their heads. There's a couple of factors involved with that. So bringing the pay plan, updating it, still doesn't move people along those steps along each grade. So those steps, the top step is the market rate of each grade or each position. So updating the pay plan brings the whole scale up by 7% roughly. Each one is a little bit different depending on how the calculation works. But it doesn't necessarily make us fully market competitive. If you remember a couple of months ago, I did that report on wages and retention, and you saw those comparisons with some of the other counties. That would probably bring us just kind of to the middle or the bottom of those ranges comparing the surrounding counties. But it still restricts departments from going past one. Step 4 is the highest step that we're currently authorized to use. So there are 8 steps on the wage plan, and right now we're authorized to go up to step 4. So step 8 is the market rate, but the county has to authorize utilizing the entire plan.
It was a market rate back in 2017.
That's correct. But if you do update the whole plan, theoretically, that step 8 would be a market rate. Yeah.
So if I remember correctly, at the time that the wage scale was done, it was at 80%. That Richland County would get 80% of the market rate. Is that still, are we at 7% below 80% of the market rate because we haven't had any raise increases?
I believe that step 8 is the market rate. Where that 80% lies, I'm not sure. I see some MIS staff.
It's 80% of the market rate. It's not the market rate. Richland County, the full market rate wasn't palatable for the full board. So they did 80% of the full market.
Okay. I guess that was before you came back.
Yeah, I'm sorry, I'm not familiar with that.
Any other questions? we'll move on to next agenda item. 13, approve a revision to the Health and Human Services addendum.
So, hi everyone, this is Stephanie Bronfeld. So this was something that actually it's kind of interesting. It's right on the heels of personnel and wages. So we tried to get creative with regards to wages, potential retention, recruitment. I think recruitment in this sense maybe will be helpful. But I had information from some of the other counties in our consortium, if you kind of look at the background. So we provide economic support services to individuals in this whole 8-county region. And there are other counties in our consortium that include a wage modifier for individuals that actually work in what are called Spanish queues or Hmong queues on our call center. So a significant portion of their day is actually spent speaking in Spanish or Hmong. And so there, like I said, there's other counties that provide this wage modifier, and they use it as kind of a recruitment tool, right? When you advertise, you can say that there's the potential for wage modifiers. So this was something that I kind of put together, Tracy and I kind of put it together, and we thought the best place to incorporate something like this would be into our Health and Human Services addendum. And just to add that Health and Human Services staff who have specialized bilingual fluency and are assigned to participate on the Economic Support Bilingual Call Center queue or provide interpreter services in the course of their duties shall be eligible for a wage matter of 75 cents. The total cost over the course of a whole year is about is just a little over $1,500, and this is something that we can charge as an expense directly to the consortium and include that in our budget with them to get reimbursed for that expense. So I hope I explained it okay. Does anybody have any questions?
Stephanie, you might have mentioned it and I missed it. Is this, how does this compare to the rest of the capital consortium members? Is it in line?
Yeah, compared to, you mean as far as the 75 cents?
Yes.
The 75 cents, some offer 75, some offered 50 cents.
Okay, but it's in the ballpark.
It's in the ballpark, right? It's not anything that, it's not more than any of the other counties are offering.
Motion on the floor to approve our revision to the handbook, Health and Human Services handbook. Is there a second? Seconded by Mr. Gotchel. Any further discussion? How many employees do we have that are bilingual?
Currently we have one. So for one person, it's the $1,560. But obviously we can use it as a recruitment tool as well. So
I will say that there are times in the past where we have candidates who have these fluency skills, so it does happen in our community.
I guess one other question would be, it doesn't state this specifically, but I'm assuming that no matter how many employees we had under this category, it would all be reimbursed by the consortium?
Correct. Correct, yes.
Further discussion? Hearing none, I'll call for a vote. All those in favor signify by saying aye.
Aye.
Those opposed say nay. Motion carries. This gets forwarded on the county board now, correct? Or finance personnel?
Yes, I believe it would go to finance and personnel next, and then on to the county board if it's approved.
Great, thank you.
Agenda item number 14, approve purchase of public health vaccination refrigerator.
Yes. Yes, I don't know if you want me to kind of re-review the board mail out. I did want to add that it sounded as if our attempts to try to make the unit operational were pretty limited, and that's not quite accurate. Not only have we adjusted the thermostat, we've contacted the manufacturer without success. We've checked electrical conditions, we've checked seals, we've done a lot of it wouldn't be anything that would be mechanically involved with this refrigerator. It's been a little bit less than an optimal unit since its purchase. If I had to describe it in one word, I would say lemon. And I just have to be completely honest. I don't go into making purchases. I'm very conservative when it comes to not only the money I have personally, but also professionally, and as a result of my employment here as a county employee. So knowing that we have not only purchased and state supplied vaccine in that refrigerator on a normal basis, but also adding the additional need to appropriately maintain a cool chain for the COVID-19 vaccine makes this refrigerator, again, even more so of a liability. So right now, I really would like to seek bids and consider the purchase of a new pharmaceutical grade refrigerator. I have sought approval from the Department of Health Services to utilize ELC or COVID-19 funding to either pay for that entire purchase or to offset the payment for such. There is other funding that we need to exhaust first, and that would not be any funding that would be out of the county's treasury. So there wouldn't be there would be no cost to the to Richland County for me to seek bids and to secure payment for the purchase of a new refrigerator.
For Rose's background of the refrigerator, the need for a new vaccination refrigerator, what is your wishes?
I move we approve that request and move it on.
Motion by Cindy Checker to go ahead and purchase a vaccination refrigerator, seconded by Ingrid Glassman. Is there any discussion? Any discussion? All those in favor signify by saying aye.
Aye.
Those opposed say nay. Motion carries. Next on the agenda is number 15, approve updates to our 2021 public health fee schedule.
Yes, and that is mine again. We have the ability, whenever a vaccine is administered, to seek a fee for the administration of such. It can be, typically it is applied as a cost to a third-party payer or an insurance company. And we're looking at formally introducing a $40 charge for the administration of vaccines, whether it be those that are privately purchased or those that are state supplied. That is one of the few appropriate types of expenses that a health department can levy in the process of providing vaccines. And so we are looking at levying a $40 fee per administration of a vaccine. Of course, payers will only reimburse up to what they would consider appropriate or according to what the person's plan would be. But by doing so, it helps to promote some revenue generation in the public health unit. And it is usual and customary for public health offices or departments to levy administration fees.
Chair, I would just add that this is a fee that's charged to Medicaid or Medicare or insurance companies. Individuals who do not have insurance would not be paying this fee.
Assume that the insurance company only pays partial of their, that the patient's not billed for this.
That's correct. Yeah, we did look into whether or not this rolled back to the consumer, and it does not.
If the person wants to come in and just receive a vaccine of some sort, they wants to pay cash up front.
It depends. Right. It depends on the type of vaccine. If it's a state supplied vaccine, there is no charge for that. We have to screen for eligibility. And then some counties can ask for administration fees from folks, but we do not have to. Right now, we are not asking or applying any type of an administration fee for COVID-19 vaccines, and they are a federal asset. If a person would be willing to pay or is interested in doing so, they might, but we do not have to ask ask for someone who's coming in for a vaccine to pay anything out of pocket.
If individuals are charged, and you can correct me if I'm wrong, Rose, we may, if they're charged for something, they're charged for the cost of the vaccine, not for that administration fee. It's our intent not to pass that along.
That is true.
What is the committee wishes?
We arrive on $40.
And I believe, Robin, you did a little bit of legwork on that $40 amount. Is that correct?
Yeah, part of it was what it's covering our costs to administer the vaccines, and part of it was looking out at the market and what insurances reimburse. And right now, for the COVID shot, Medicare reimburses $40 for this specific charge. So,
right.
Try one more time. I'm sorry. I know you guys just explained this whole thing. The administration fee is only billed to Medicare, Medicaid, or the insurance provider, right? That's what you meant by not charging an individual with.
That's correct.
Okay.
So if there is either requirement, so there's a fee for the actual vaccine, and then there's a second fee that is for administering the vaccine. So the administration fee would not be charged to the individual.
Right. And I will be honest in that when the fee schedule is set for privately purchased vaccines such as hepatitis B and influenza, we are actually taking into consideration some of the fee associated with providing that vaccine. So when I look at the cost associated with a per dose purchase of influenza, whether it be a quadrivalent, and that's typically for those who are 64 and younger, or for a high dose vaccine for those that are 65 and over, when we set the cost for a private purchase or a transaction, we have increased that to include much of the supplies and the overhead associated with the administration. So we don't look at asking folks for additional money. We have built some of that in. We get very few cash purchases, however, but when we do, we would not ask for anything in addition.
Pleasure.
I make a motion to accept the 2021 public health fee schedule.
Motion by Diane Cox to accept our 2021 fee schedule.
I'll second.
Seconded by Cindy Chicker. Is there any further discussion? Hearing no further discussion, all those in favor signify by saying aye.
Aye.
Those opposed say nay. Motion carries. Next on our agenda is agenda item number 16. Motion to be appropriate for adjournment. Or I guess we don't have to, right, Brandon?
I make the motion to adjourn.
You don't have to if you reach the end of the agenda.
Yeah.
Oh.
Second, anyway.
Motion and a second. All in favor, signify by saying aye.
Aye.
Opposed, nay. All right, motion to adjourn is carried.
Is that according to what?
Reach the end of the agenda. The meeting's